Yes, a very good morning and many thanks for staying with us right here on NTV Uganda. My name is Romeo Bisiku. Of course, the coronavirus pandemic is still rearing its very ugly head unabated. On the international scene, we are talking about 204,600,000 cases of COVID-19 being registered on the global stage. Uganda alike is also grappling. 96,067 cases of COVID-19 have been registered in this jurisdiction of ours. 2,821 people have actually succumbed to the heinous novel coronavirus disease. So many people have been grappling, but also people living with HIV have also been battered the most by this COVID-19 pandemic. The issues to do with uneven access to antiretroviral therapy or treatment have actually taken a bound during this COVID-19 pandemic. We do know that there are some 1.4 million people who are grappling with this disease, HIV, here in Uganda. So the focus being too much on COVID-19 made us forget about other illnesses or other diseases, HIV inclusive. So we are here, and the National Forum of People Living with HIV and AIDS Network Uganda is sounding an alarm, and they are saying we need to increase access to antiretroviral treatment for the people living with HIV. To expand more on this conversation, I do have Dr. That is Dr. Watiti Stephen. He is the board chairperson for the National Forum, for people living with HIV and AIDS Network Uganda. We also do have Dr. Alex Muganzi. He is also the head of the Health System Strengthening Department at the Infectious Disease Institute, and is also a board member for the National Forum of People Living with HIV and AIDS and Networks Uganda. So there you have it, Dr. Alex Muganzi and also Dr. Stephen Watiti, both of whom join me right now on this set to talk about how the COVID-19 pandemic has actually battered people living with HIV and AIDS. A very good morning, gentlemen. Thank you for joining us.
Good morning.
All right, I believe my viewers would first like to know what is NAFOPHANU? What is the National Forum of People Living with HIV and AIDS Networks Uganda? Let me start with you, Dr. Stephen Watiti.
Yeah, good morning once again, and nice to be here. NAFOPHANU, the National Forum of People Living with HIV Networks in Uganda, is an umbrella organization that brings together the over 1.4 million people living with the virus in Uganda. We are in almost all districts of 135 districts of Uganda. We have a secretariat in Kampala, and I happen to be the chair, the board of governors of the forum. So without guessing, I'm also one of them, people living with HIV, because our constitution says that the chairman must be a person living with HIV.
Indeed. All right, let's also hear it from Dr. Alex, the Infectious Disease Institute. What do you do there?
Right, thank you. So the Infectious Disease Institute at Makerere is one of the implementing partners for comprehensive HIV services in Uganda. It's a center of excellence that provides HIV training, HIV research, and HIV care. For clinical HIV implementation and prevention, we implement services in Kampala, the whole of Kampala and Wakiso. IDI is the lead implementing partner in the whole of Western Nile region, and then we support work in other districts of Uganda, including TB work in Karamoja region, some work for orphans and vulnerable children in Midwestern Uganda, and the different programs including research, capacity building, laboratory services, touch on the different, serve the different corners of the country.
Of course, COVID-19 is ravaging our population. Over 96,067 people have actually been infected with this disease. Are you currently undertaking any research for maybe a COVID-19 vaccine at the Infectious Disease Institute?
Right. So the research portfolio at the IDI at Makerere looks at different things that are in line with the institutional goal and mandate. What I can say for now is that the Institute is involved in COVID-19 work, majorly through its Global Health Security Program.
Yes.
And the research might not be necessarily about the HIV vaccine, but we are doing work that is aimed at making COVID-19 care models and prevention models feasible in this country.
More like you're expanding more on research to take a look at the behavior of the COVID-19 disease.
Correct, but also supporting programs like infection prevention that can help scale down the risk of
All
getting
right.
infected.
That
with
is Dr.
COVID-19.
Alex Muganzi, the head of health strengthening, that is the head of the health system strengthening department at the Infectious Disease Institute. Let's also bring in Dr. Stephen, and we talk about how this COVID-19 pandemic, particularly the measures we've instituted, how have these lockdowns we've instituted affected people living with HIV or the fight against HIV?
Well, to start with, of course, the disruption of the service.
Indeed.
The fact that we got a lockdown, that means people cannot access treatment and other accompanying services like counseling or having their blood checked for viral load, which is a very important function of monitoring whether the medicine is working or not. I think it does affect us. Of course, we also know that of the 1.4 million, 1,460,000 about, living with HIV, we have just over 1.2 who are on treatment. That means there are over 200,000 Ugandans who should be started on ART.
Mostly being men.
Most of them, yes, most of them being, many of them being men. Most actually, as you may have said, because men have poor health-seeking behavior compared to women. So they cannot get these services. But even those who are on treatment already, getting refills, which is a necessary thing to be done all the time, you must have refills maybe every 3 months. Now some of them are even getting for 6 months. If this happens, that you are, say, getting out treatment, say in Kampala, but you have gone to Mbale or gone to Arua, and then you're caught there, it means you cannot get access to this treatment. Another thing which is very important for us people living with HIV is the issue of counseling, what we call social support, also psychological support. HIV puts a lot of stress on people. And they must have access to counseling. Now, counseling cannot be done when you cannot go and get a counselor. So these are some of the services. And also, for example, women who find themselves are pregnant, they would want to go and find out whether they're positive, because we know that if we are to stop infant infections among children, we must have access to services, voluntary counseling and testing. These have been disrupted. So this is going to make a problem, a challenge. As I finish on this one, you see we have been losing about 50,000 people to AIDS-related causes, even before the pandemic, totaling to about 19,000 deaths annually. Now you can imagine this is going to increase it, or it has increased it. We may not see the figures now, because if somebody dies with because of AIDS, and then maybe they also have contracted the COVID, the report will say that he died of COVID. Instead of HIV. But actually, this person died because his immune system was compromised. Yeah, many people get COVID, most of them actually, and they recover because their immune system is good. Yeah,
we are also getting reports that during this COVID-19 pandemic, we could be having a lot of mother-to-child transmission. More young children actually getting infected with HIV, simply because we focus too much on the pandemic and not really the HIV disease. If a mother is going to go to a hospital or health center, the doctors are going to be looking for COVID-19 and not whether or not this mother could be a carrier of HIV, which she could pass on to the child. So we might have dropped the ball when it comes to issues of preventing mother-to-child transmission. Would you say yes to that?
I would say yes, and I'm sure my brother will add something. We have had, for example, that in some districts over 100 children were impregnated during this time. Now, nobody is saying about how many could have been infected with HIV.
Indeed.
And many of these cannot exceed the goal for antenatal services, because normally when they go for antenatal services, we encourage all women who go for antenatal services that, look, the way most people get pregnant, the way most people get infected with with HIV. So you test, and when we find them early, we put them on treatment. This certainly helps reduce the numbers of children born with HIV, which are done very well, because I remember in 2012, 2011 there, we're having over 25,000 children born with HIV in Uganda. Now we have come down, I think, to less than 3,000, but this could become a problem if we continue this lockdown.
Dr. Alex Muganga, would it be safe to say, of course you're going to react to what Dr. Stephen Watiti is actually submitting, but would it be safe to say that we've regressed when it comes to the fight against HIV, simply because of the focus on the COVID-19 pandemic? Have we lost the points that we had actually achieved over the years when it comes to battling this epidemic?
Right, thank you. Excuse me. So, like, with all the different disease conditions, what I can say is that access to HIV services during COVID has been challenging. Challenging for reasons that Dr. Watiti has indicated. Access to care has been a challenge. Nutrition has been a challenge. In the most recent wave, we've seen hospitals flooded with only COVID-19 patients. But that doesn't mean that people are not falling sick from other diseases. So access has been challenging. Lockdowns have made access to services challenging. People not working, especially the low earning people who survive on what they work for every day, were not able to work, say, over the last 6 weeks. And then that means they cannot get the food to take their medicines with. So nutrition aspects and all the other aspects. So COVID has made access to HIV services challenging. It might be too early to say we've regressed, but I think a few months from now, years from now, when we look back, we might be able to say this epidemic, because of affecting service delivery for clients who needed services, HIV services, this ultimately led to regression of.
Of course, the effect can be seen boldly by the people who are watching the show, because the facts are already there. The people who have been infected with HIV have grappled when it comes to access. But what about those new infections that are being brought about by other factors like poverty? Yes, we are too poor in our family, so this young girl has to go on the streets, become a prostitute so that she can, make a living or make a living for the family back at home. So can we talk about such factors that are increasing new infections during this pandemic, things to do with poverty and so forth?
So those risk factors truly can be linked to increasing risk of infection. And that, again, is a challenge because, if people must work in abnormal ways to survive, then they are putting their already existing conditions at greater risk.
I think also there is evidence that there is increase in gender-based violence.
Indeed.
We have seen cases of gender-based violence. Indeed, even in the increased teenage pregnancy is a form of gender-based violence. These children are violated, they shouldn't be pregnant.
And who is violating them? Family members?
It is sometimes, we've heard even fathers,
Incest as well, right?
Incest, yes, because men who were out going to look for money and other things are now locked up at home. So sex becomes, they're forced. Many of these women are forced. I can't go in detail, but we have heard stories of women who are living a normal life, because the husband or partners were not there most of the time. Now these women were taking medicine, but when the man comes around once in a while, provides, now the man is at home most of the time.
Yes.
The man is not earning money, and they can become what? They can get what? Depressed. Depression among people living with HIV is very common. And I can imagine now with the lockdown, it is going up. Indeed. So many of them end up in alcoholism or doing other things which they wouldn't have done if it wasn't. So of course, lockdown is necessary. But I think we need to have known that there are over 1.4 million Ugandans who have HIV, who already need these services. We should have factored in more. I know something was done, but we need to have done more. Like we've talked about food. Many of these people need food before they swallow medicine. So if your nutrition, if your source of income is reduced, that means you cannot have ready access to food, especially in the urban. Because the rural areas have their challenges, and the lockdown hasn't affected them so much. But you remember, we are interconnected. The urban and the rural areas are interconnected. So this is a real challenge. GBV and also poverty, which I've alluded to, are the real factors, drivers of the epidemic, which certainly are going to increase.
Indeed, and also stigmatization, Dr. Watiti, the fact that when they laugh at the people living with HIV, they do not seek access.
Yes, stigma is a real issue. For example, to go and get a letter that you're going to hospital, you need to go and disclose to the powers that be that, look, I need to go to hospital, what are you suffering from? You have to tell them, or tell them a lie which can be found out and it's not good, or show them the card that, oh, so all along you are like this. Now people feel ashamed. The stigma, the shame, the fear of discrimination, then they deny you. The fact that people are saying they don't have this disease leads to what we call misaction, doing things that they wouldn't have done. They do something but is a wrong thing which makes the problem worse. Or inaction, just say, I'm not going to do anything. There are people who are out there, they've said, I'm not going to swallow medicine for this this time, and that's very bad. They should be getting treatment. Luckily, we had guidance from the Ministry of Health that you are getting your medicine. I get mine at Mildmay, Uganda, which is on Entebbe Road. I come from Bale, maybe I'd go to see my mom. If I'm stuck there, I can go to Busano Health Center 3, which is near home, and pick this medicine and be able to swallow. How do I go to Busano if I'm fearing, if I'm ashamed, if I cannot go and say, look, I am living with HIV and this is my medicine, give me. And they have it there. Because some of the people who get it from there also stuck somewhere else. So this is the stigma is a real big issue which we must hold.
Of course, Dr. Alex, when you talk about stigmatization, the viewer who is watching might think we're talking about community members. But even when you go to a health center, there's stigmatization coming in from the health workers. In that if a teenager walks in and they are seeking HIV treatment or ARTs, this health worker will look at them like, oh, you also get involved in sexual acts? Stuff like that. The fact that they are demeaning young children when they show up at these health centers to get some help. And also, could stigmatization be the reason why men are not seeking help or treatment when it comes to ARVs? Like he alluded, he said 1.4 million people are living with the disease, 1.2 are seeking help, but 200,000 plus are not seeking this help, a majority of whom are men. Why?
So traditionally in this country, the health-seeking behavior of men is not as good as that of women. I think close to 67% of people who attend our clinics are female. And naturally, women are more concerned about their health than men.
Naturally.
And for some of our programs...
Is this the same in the US, Germany, China? Or it's just a Ugandan problem?
Let's say for our community.
For our community, go ahead.
What we've done in some of the societies is to ask... women to come along with, say, their men, their husbands for antenatal care, and offer them incentives like a fast pass. If you come to antenatal care with your husband, there is a special line where you don't wait for long, in an attempt to ask people to come in and seek services. That said, I think the healthcare workers, and I'm a healthcare worker myself, are trained not to be agents of stigma. So I don't think healthcare workers at a facility would be the ones stigmatizing.
It has been happening too much. I did the People's Parliament, especially in Kavale. Around December, Kavale had 3,000 teenage pregnancies. You would imagine, in the lockdown that had just been instituted, 3,000 young girls in Kavale got pregnant, but majority of whom tried to access health services, maybe PEP and other drugs, and they refused to give them to them, simply because they were children and they didn't think they needed any of these services. Dr. Watiti.
I think this is a shame, really. It's a shame on us as a nation.
So if I don't get my PEP drug, I'm getting HIV, I'm getting pregnant.
These are children who are being violated, and then we refuse to give them services. But then the other thing, as you mentioned, to have HIV, this fear and the shame that people feel. You see, when you tell somebody that you have HIV, it's like you're confessing you have done something wrong.
Indeed.
Not at all. HIV is got when you have contact, could be sexual contact, most of it is sexual contact, with somebody who has the disease. This person could be your wife. This person could be your husband. Unfortunately, it can be somebody who rapes you.
Indeed.
And so when somebody rapes you, are you the one in the wrong or is the person who does? So when I run to a health student and say, look, I need PEP, the question they should ask me, what has happened?
Indeed.
And they take the history. History is very important. And when somebody says, I got HIV, I got sexual contact with somebody, I need this, that is very powerful. We call this literacy. That person knows what to do and he's asking for something. So to say now, that means you're bad-mannered, that is a shame. It's a shame on us. But back to the point, we need to put the facts out there in the community. We need to tell our people that, look, HIV, as I've mentioned, just means you have been exposed to the virus. You could have been exposed to the virus in the womb of your mother. Have you done anything wrong in the womb?
Not really.
Or in your bedroom with your wife? Have you done anything there wrong? Or you could have gone to the street. Again, that is, of course, illegal, and I don't commend it myself, but people do it. So our as health workers, to catch this, is to say that, yes, the one who is exposed or at risk of being exposed should be given access to PEP, post-exposure prophylaxis, or PrEP, for example. There are people who are in discordant relationships. They should be getting this medicine. But more important is that people living with HIV who are already in the community there should have access ready and continuous access to ARVs. Because when these people take the ARVs with good adherence, like I do and many others out there, their viral load, the amount of HIV in their blood is suppressed, and they cannot transmit HIV even if they had sex or they become pregnant. I think lastly on this one, the issue of support, which she has mentioned, it is important that every person out there forms, who is HIV positive, forms a support system. Okay, you can go on and make a big one, like my friend Canon Gideon Biamugisha has formed what they call Friends of Canon Gideon Biamugisha.
I see.
Yes, for him he went ahead. But I should have my own. Where Romeo, you are a part of it. Where my brother Alex. The Friends of Watiti.
Yes.
So that in case I get a problem, I can say, Romeo, I have no food. Can you send me some mobile money?
And nephew would come through. All right. You're still watching this show. We are largely taking a look at how the impact of this COVID-19 pandemic has affected persons living with HIV. There are over 1.4 million people living with this disease right here in Uganda. But the focus has too much been on the fight against the COVID-19 pandemic. So we are saying, if you're a pregnant mother, you need to ensure that you go for early antenatal care. It's really important so that they can be able to see whether or not you're having HIV to protect that unborn baby. That's the biggest issue right there. And that's why I'm having Dr. Watiti Stephen and also Dr. Alice Muganzi. Dr. Muganzi, let's talk about what happens or the impact of poor adherence to antiretroviral therapy, because the leaders are watching. When they institute these lockdowns, they might not know that they're curtailing access to antiretroviral treatment. And when people do not access these drugs, some issues happen to their body systems. What exactly happens? The effects of poor adherence to ARTs.
Very good, thank you. So the starting point perhaps is to tell the viewers what is the role of antiretroviral therapy.
Let's start from there.
The role of antiretroviral therapy is to suppress the virus that is in the blood of an infected individual to numbers where the person cannot get what we call opportunistic infections. So we indicate that as undetectable viral load. The virus is there, but in small amounts that, the virus kind of remains sleeping. And someone is able to do their day-to-day work without any serious opportunistic infections. So when people don't take their drugs, then we'll not be able to achieve what we call maximum viral suppression. And what that means then is that the virus which has been sleeping will wake up, start multiplying, and then weaken the entire system. And the person that had gotten stable and was able to do their day-to-day work without any challenges starts getting what we call the opportunistic infections. It could be tuberculosis, it could be meningitis, it could be other diseases which take advantage of a system that is already weak. So it's important that clients that have HIV and have been put on antiretroviral drugs take their drugs regularly on a day-to-day basis as prescribed, so that they can keep that virus at a level that is undetectable, which allows them to live a normal life. And we have people in this country who have been on antiretrovirals for many years and are doing very fine.
Indeed. Dr. Watiti?
Yeah, I think I really want to pick on that. That the over 2 million, most of them, I think we're now at about almost 90%, most of them are doing very well.
We're hitting the 90-90-90 target soon.
Yes, we are going
95.
towards 95.
Nice.
So I want to encourage those first and foremost. If you are there, you are HIV positive, you know it, and you have access to medicine, please swallow it with good adherence, meaning you swallow the medicine at the right time and in the right doses as agreed by the doctor. When you do that, as he has mentioned, you not get TB, you not get meningitis, you not get these other diseases that he called opportunistic infections. I call it, and what is they take advantage of of your weakness and attack you. But the other thing which I've already alluded to is that when you do that, you not get AIDS, you not suffer AIDS, but you not transmit. So it's double-edged. You are not sick, but you're not transmitting to your baby or to your loved ones through sexual contact. The problem is that in Uganda, we are still having many infections now. Before the lockdown, we were talking about 1,000 new infections weekly.
Indeed.
A lot of people getting infected. By the end of this talk, many people have got infected. The main reason is that there are many people out there, or some people out there, who still have a high viral load. So our per capita viral load is still high. We need to bring it to zero.
Especially among men.
Yes, but per capita means we are sharing it.
Even with the women
yes,
and children.
all of us. So when there are people out there who still have it high viral load, then we shall get infections. In fact, the lowest hanging fruit are babies. Nobody should be born with HIV in this country.
Indeed.
It takes 6 months, 9 months. We see somebody, and we know they are pregnant. We should be responsible, should find out, could this person be positive? Therefore, we should give their own treatment. If they're on treatment, they cannot transmit HIV to their baby, either in the womb or during birth or when they're breastfeeding.
But guess what, Dr. Watiti, we are getting information that mothers are giving birth in the confines of their homes. They're seeking help from unspecialized medical workers to actually handle
I think this
the issue for them.
This is an indictment on us all. We have had modernization for a long time. I think modernization was one time even a catchword here. So why should you deliver at home like a god? And you have had time to know that you are pregnant. 2 months, no period.
Care. You don't know your status.
So when you miss your period for 2 months, you should go to a nearby health unit and report yourself and say, I'm expecting a baby. Go with your husband. Because when you go, they'll test you for HIV.
Indeed.
Most likely it will be negative. But the man at home may be positive. When you go home, when you're celebrating your negativity, you get infected.
Indeed.
And then the baby is infected. So we are saying, men accompany your wives when they go for antenatal, test together, so they don't have to have the burden of disclosing to you that I'm positive or I'm negative. Then when you have known that, guard that and make sure that if one of you is positive, then be on treatment. We already mentioned the benefits of treatment.
Indeed.
It will be a win-win for all of us. By 2030, we should not be talking about this disease, for God's sake. We should be talking about other things.
Indeed.
Yeah.
Dr. Stephen Watiti, thank you very much. Dr. Alex had a submission to make before we go for a short break.
Just to add that
Indeed.
when people fail on their first line of treatment, they need to understand that the second line regimen is more complicated than the first one.
Indeed.
And so it's in our interest that people stay on the first line regimen that is given to them for as long as possible, because the second line usually have more side effects. Have conditions that they require. Some require, refrigeration, which is a challenge in this country. And so
it's more expensive.
It's more expensive
regimens.
All right. Very insightful conversation I'm having with Dr. Alex Muganzi. He is the head of the Health System Strengthening Department at the Infectious Disease Institute. We also do have Dr. Stephen Watiti. He is the board chairperson for the National Forum of People Living with HIV and AIDS Networks, Uganda. The main conversation largely pertains to the fact that the COVID-19 pandemic has largely made us forget about other diseases like HIV, which is a recipe for disaster. So we need to ensure uninterrupted access to antiretroviral treatment or therapy. And that's why I do have these two doctors in this building or studio to ensure that they are acquainted with the information that you need if you're a person living with HIV or simply a young teenager who's just watching this show. Let's take a breather, return shortly with more information. Domo Vumaso, we'll be right back. On NTV Uganda, if you're a person living with HIV, this is a conversation you do not want to miss out on. Yes, trust me on that, because we do have Dr. Stephen Watiti. He is the board chairperson, National Forum of People Living with HIV and AIDS Network Uganda. He's not alone. He comes with a wealth of information. Please, we also do have Dr. Alex Muganzi. He is the head of Health System Strengthening Department at the Infectious Disease Institute under Makerere University. Am I right? All right. Let's talk about continued access to antiretroviral therapy. What is being done, Dr. Watiti, to ensure continued access to antiretroviral therapy during this COVID-19 pandemic?
Well, even before this was there, because we knew that the ministry came up with what we call the differentiated service delivery, that not all people who have HIV and on ARVs need to go to a health center. There are systems, we can take this medicine in the community. You can access it at pharmacies. They can put this medicine there. So discover this. First, find out from your health unit, is this possible for you to get it? They have, for example, even been giving people whose viral load is suppressed, they're giving us medicine for up to 6 months. So you can go and stay somewhere. 6 months is a long time. And you don't have to see a doctor, so long as you're swallowing your medicine with good adherence. We also got guidance from the ministry, and we want to thank our friends at the ministry for this guidance. Telling all the over 1,800 ART sites in the country that, look, when a person living with HIV comes, with the requesting for refill, give them medicine. Don't make it hard. I know some of them were saying, no, you're not our client. We are he's your client. He has a person. Now, the challenge has been that some of them don't have a card. They don't have a carry this card. Some of them don't want to carry cards because they don't want to be identified. Some of them, even when you give them medicine, they remove the label. So you just find a bottle and they don't know what is inside. So this is difficult to be helped. When you go there, please identify. And we encourage our people to know the medicines, know the names if possible, or take a photo of the medicines, or write them down so that when you go there, this is the combination I'm on. Don't say that I'm just on the white ones or the yellow ones. That one doesn't help because this keeps changing what. I think that is the main thing. The issue, the other is you should not stop taking your medicine. For example, if you're in a district, there is what they call the district health officer. That district health officer knows exactly where ARVs can be found. So I would advise that if you're a person living with HIV, have in your phone the number of the district health officer of your what? Of your district, or the ART focal person at your center. You can call them and say, where can I get this medicine? They will guide you. Don't sit there and say, they've locked, I'm not getting medicine. If you have other issues, like, for example, access to food, confide in the LC system. The LC system has a person who cares for people. I think it's the vice care person who normally is a lady. Tell them, look, I am a person living with HIV. When it comes to giving food, they should be expedited. See, even the money which was being sent by the Honorable Prime Minister, these people living with HIV, I tell them, you'll be the first on the list. Tell them that for us, we are vulnerable. I must have food every day if I'm to swallow this medicine. And it's also your responsibility, because if I don't swallow medicine well, I'll die, and you don't like that.
Indeed.
And before I die, I might infect you. Do you want that?
No.
No. So it's a win-win. Make sure that I swallow my medicine well, but support me. Then it will be good for you and for me.
All right. If you're watching this show and you are a teenager and you're thinking, no, this is a conversation largely for the adults, then you have it all wrong. You could have been defiled yesterday, you could have been raped yesterday, and you're saying, yeah, I'm done for. Let me just wait for HIV. Let me also just wait for pregnancy. No. There's a drug you can take. There is PEP. You can take that PEP drug to avoid actually contracting HIV. There's also another drug that you can take, a contraceptive, to help you from getting pregnant in that regard, if you do not want to get pregnant, since you are still a teenager. So largely, this is a conversation that you should pay attention to, because it actually it affects you as a young person. I also do have Dr. Alex Muganzi, who's going to be telling us what is being done to ensure continued access, more like adding to what Dr. Watiti has just submitted. Please make an addition onto that, and also acquaint us with another narrative, whether or not people with HIV are at an increased risk of contracting COVID-19.
Right, thank you. So some of the things we've done during the lockdown include, as Dr. Watiti said, linking clients to facilities that are near where they stay. But we also organized in some of this, urban centers like Kampala, Wakiso, we have organized delivery systems through our traditional border. So if people were unable to come to a clinic and we had their contact, some of the clinics, like our IDI clinic in Mulago, were able to organize and package drugs and deliver them to clients. Working through organizations like NAFOPHANU, we've also worked with some of our networks to have those drugs delivered. I remember recently in July, we had to deliver drugs to our client out of Kampala through a police truck that was traveling that side. We made contact with the Uganda Police Force and had to put drugs labeled to the destination they were going, to a person that was out of here, all in an attempt to make sure that people don't miss out their drugs. We've also given clients what we call toll-free numbers, so that when you are stuck somewhere or unable to come to clinic because of these challenges, you call that number, and then your clinic can work out a mechanism to offer you those services. Our clients with HIV at more risk of COVID, I think the underlying statement is that we are all vulnerable to COVID. That's why we are stuck in these masks in this studio, because we are all candidates for COVID. So what we need to ensure is that we all take precautions to ensure that we do not get infected with COVID. We avoid crowds, we wash our hands with soap and water, sanitizer.
Indeed.
We mask up and wear the masks properly. And when we get a chance to be vaccinated with available vaccines, we get to go and get a full vaccination. There is now a lot of evidence to show that people who have received full vaccination are will not get severe forms of COVID disease, and the chances are as high as 95% of not getting severe disease. And those chances are as good for the vaccines we have here and the vaccines we have in Europe. So I think what determines how severe or how risky COVID might get you once it gets in your body is the state in which your body is found when it gets there. We've had clients or patients whose lungs get eaten away in a very short time.
That's what happens.
Dying off in about 3-4 days. We have people who get a test through a routine screening test positive, and they don't get any sign or symptom, and walk through the 14-day or 21-day cycle and get to test negative. So I wouldn't generalize that people with HIV are at more risk, but we all need to take the precautions that we should to make sure that we do not get COVID.
Dr. Watiti?
Yeah, I think he has mentioned it. You see, HIV affects our bodies by attacking our immune system. The body is made up of systems. The digestive, the circulatory, then the immune system. The immune system, I always tell my patients and my friends that is like your PPU.
Yes.
Your personal protection unit. Now, if your personal protection unit is weak,
I like that.
then it means any disease, including COVID, will attack you. But if your personal protection unit is strong, you can even be attacked, but you will not be pushed, easy to push over. Now look at me, I'm over 65 now, and I'm HIV positive.
Indeed.
But I'm on medicine. My immune system is fairly good, even for an old man of my age. In December, around the World AIDS Day, I was involved in many activities, moved all over this town, talking about HIV.
Outreaches here and there.
Yes, and you guess it, I got COVID.
Indeed.
I got COVID, and for about a week, I was very weak, very sick, but I didn't not need admission. Anyway, to cut the long story short, I pulled out, later on tested negative. And in March, when they were launching the vaccination, I was the first on the line. Among the first. Yes, vaccinated. And I even posted my picture to encourage my friends that, look, take advantage of and be vaccinated. It doesn't give you 100% protection, but as he said, in case you get it, it will not be so severe. And I got the second dose, and I'm here, as you can see. So the fear of what? Of vaccination among especially people living with HIV is unfounded. Go and be vaccinated. Take normal precautions like any other person. Avoid crowded places unless you must go there. But if you're in the front line like some of us, it's part of your work. Work normally, take normal precautions, sanitize, wear masks, and so on. I think this is a disease that especially we people living with HIV should really find it easy. Because for us, we know behavior change is part of our life. We change our lifestyle. We change what we eat. We stop smoking, we stop drinking. Of course, we should do, those of us still drinking. And the HIV
so it
positive.
wasn't hard for you to make that switch?
No, it wasn't. So it is important that we learn from what you have, the knowledge you have picked from HIV and fight this disease. COVID, it means changing your lifestyle. You like to go out and shout in the community, go stay at home.
Please.
You don't like washing your hands regularly, wash your hands.
Indeed.
Hopefully, maybe there will be a cure. Maybe the vaccines will reach us, but they will reach only those who are alive. Those who have died, even if the vaccine come here, they were not going to help them. Just like those who have died of HIV, even if a cure comes or ARVs come, it will not help them. So we need to keep the eyes on the ball. HIV is still real. More people are getting infected, over hundreds. Over 100 are getting infected daily. We get over 1,000 infections weekly, especially among adolescent girls and young women. We get so many deaths, over 50 daily, especially among men. Men are dying more than of this disease. So I want to advise especially men.
Simply because they don't get tested.
Yes. They test some of them and they keep quiet. I know a friend who tested
they find out they are positive and then they keep quiet?
Just keep quiet. It's like putting fire in your pocket and keeping quiet. Eventually it will burn you. Don't do it. Don't do it. It will burn you.
You're telling us about your friend.
I was telling about my friend who tested and just kept quiet. The other day he got Kisipi, then he called me. Luckily, it was not on the face. So I told him, you go. He said, no, I'm still waiting. I said, don't wait. Go yesterday. Go for this treatment yesterday. And the treatment is there. We have ART centers, and then all over the country. Good job by the government. In every district, there are ART centers. Some of these drugs even sometimes expire there. Go and get those medicines. Call lines. I think there is a line that we shall give you from NAFOPHANU. Call and ask.
Yeah, we shall share it.
Yeah, call me. My line is in the public domain. I always give my number. Call me. I don't have all the answers, but I know. If you call me, I may not know the answer, but I know him.
Alex,
he may not know the answer, but he knows somebody. This is called networking.
Indeed.
We can all work together to make sure that this disease doesn't kill another person in Uganda.
Indeed.
It does not infect another person. But as I've told you, the statistics are not very good.
Indeed.
1,000 new infections weekly, especially of our young girls and women.
Indeed.
And over 50, so many deaths. This is not good.
Indeed. Essentially what Dr. Watiti Stephen is saying, the fight against the HIV epidemic is a concerted effort that needs everyone to get on board. Not only himself or NAFOPHANU, no, or PEPFAR, or Minister of Health, all stakeholders as a whole, community members. When you see someone ailing with this disease, do not laugh. Just find a way of how best you can be able to help. If you see a young girl accessing some kind of sexual reproductive health services at a health center, do not laugh still. Find a way of helping this young person, find out the history or the genesis of their problem and be able to chip in to help. I do have Susan Mujawa right there on sign language. This is a very inclusive show because we do even want those who are deaf or disabled who cannot hear, those who cannot see but can hear, so that you can be able to get this information in a verified manner. Dr. Alex Watiti, let's talk about how COVID-19 will affect the fight against HIV. Response.
I think Dr. Alex.
Dr. Alex Mugazi.
Right. So, COVID has, as we've said before, COVID has taken center stage over the past year or so, and the worst scenarios have been, from the period between May and into end of July, when all systems around healthcare delivery were resolving around COVID. Even people with money in this country could not access, a bed in hospital to be admitted.
That's how bad it
and
was.
so that's how bad it gets. And we are not yet out of there because, as we know, one of the things that could potentially get us out of there is, on top of following the SOPs, is to get the numbers we require to vaccinated. So it's going to be a long haul. But I think as the community, we need to make sure we do our part.
When you hear statistics coming in from Mulago Hospital that pertains to actually show that 80% of the deaths, the people who actually died as a result of COVID-19 had underlying health illnesses like HIV, what comes to your mind?
So it gets back to what Dr. Watiti said, that how COVID-19 treats you when it gets in your body depends on how it finds your body. So we now know that patients that have underlying conditions like diabetes and others are more at increased risk of bad outcomes, and also those who have not been vaccinated. So that's part of what we know from the science. So when your body is weakened, the immunity is weakened. Dr. Watiti called it PPU, personal protection unit.
Good one.
Yeah. So it's important that our individual PPUs are ready to fight an infection that would come in, whether it's an ordinary flu, whether it's an ordinary malaria, because each of those that comes into your body weakens the immune system. When we explain to clients that we deal with in the HIV clinics, we tell them that the immune cells are soldiers, and those soldiers are on standby to treat to defend them against infection. So when those basically the soldiers, as we call them, get weakened, then your body is left defenseless. And it now starts receiving whatever infection hits it. And the outcomes might not be that.
When we continue instituting these lockdowns, when we continue putting in place all these measures geared towards curtailing the spread of COVID, essentially we are asking, don't you think COVID-19 as a pandemic and the measures we are putting in place will make us regress against the fight against the pandemic?
I think yes and no. these things are normal. Suppose there was war.
Indeed.
Would anybody need a lockdown? We will all be hiding.
It will be
But
automatic.
Yes. So for me, although I'm not so comfortable with it, it can happen. It has happened to us here before.
Yeah.
In 86, 85, I was here when the war was on. And we hid.
Indeed.
We hid. We need a lockdown. But anyway, back to the point is this. We need to look at our health in totality. HIV, yes. But you yourself, look at yourself. Your health is, even HIV, of course, the disease, we have mentioned that, as he mentioned, that it affects you when your immune system is weakened. HIV does that. But now COVID finds you weak anyway. Maybe you have diabetes, you have high blood pressure. Now there are so many people who are walking the streets of Kampala, they don't know their blood pressure. They don't know their state. But I always tell people that if you stand, especially when you are naked, in front of your mirror, and try to look at your feet without bending, and you don't see them, it means there is a problem. Except if you're pregnant.
Indeed.
It means you're overweight. And that means COVID can easily push you. Now that one, you don't need a doctor. To just stand in front of the mirror and try to look at your feet without bending, you don't see them, it means you are in the range of COVID-19. You need to be a what? So we need to be health conscious. We need to have health literacy.
Indeed.
Know your body.
As an individual, find out.
Know your body. Just like you know your car. Cars move here, but every person knows this is my car. So people use their bodies as if they have spare ones, as if saying, if this one fails, I'm going to be conscious about your health, what you eat, exercise. Make sure that if there is any red light, for example, you check your weight, it's too high. I've told you, try to look at your feet and you can't see them. See a doctor. Have a doctor in your phone. You have one of the car, the plumber, the electrician, the one for the hair. Have the one for the whole body, whom you check. Not a specialist. Any doctor can help you. If we did this, and especially with people living with HIV, we would actually live very, very fruitful lives, good quality lives, as I call them. Because if you don't do that, you are going to live in agony. If you are not organized. What I'm saying, let's be organized, especially people living with HIV. For example, when they announced that there's going to be, like I heard here now, they're talking about a MIOGA or this registering for these funds. The people living in HIV should be the first on the list. Go there tomorrow.
Indeed.
You go there, be the first, and say, register. You don't have to tell them you have HIV.
Yes.
But in case they need more evidence, you can bring that out. And you can call me to support you.
Indeed. Now, as a forum that is in the National Forum of People Living with HIV and AIDS Networks Uganda, what are you doing to ensure that you integrate psychosocial support and reduce stigma amongst people living with HIV during and post-COVID-19?
Even before COVID, we had put there, for example, the forums in the districts to encourage all people to register in these forums. Even if you are not open like some of us, you still can be registered. Just register and say that I'm a person living with HIV, I'm in here. We often go and give support. We call, we even have lines. I think you have a line, I don't have it on my line, call it SALT. It is that NAFOPHANU. If you call that line, they can give you somebody to counsel you. We don't have counselors all through, but through networking, we can know that if you are in, for example, in Moroto, I can call a person in Moroto who is the chairman of the forum to help you. If you are in Zombo, I have the number of the person, or the ED of NAFOPHANU. Doctor, our friend Stella has the number. We have support. For example, I know during the lockdown, he mentioned people delivering medicines. I saw my friend Kraish Mubiru driving his very old car and delivering medicine. This is also support.
Yes,
even food, we share food. Some of us throw food. And yet some people are starving. We share food, especially people with HIV. We look at each other as brothers and sisters. Networks. We are in this together. We do not want to leave anyone behind. And our friends, for example, at UNAIDS have been so supportive. Really, all of you people living with HIV should be very, very appreciative of UNAIDS. They paid for people of America giving us money. Of course, our own government.
Indeed.
Yeah, but we are saying until we have zero new infections, zero AIDS-related deaths, and zero stigma, this feeling of shame and fear, then we still have some work on our hands.
If we have 0, I want to go to Kololo and we celebrate.
Indeed. Dr. Alex Muganga, let's talk about some of the other fears that are abound among people living with HIV. You have those individuals who fear that they may have contracted HIV during the COVID-19 pandemic. What advice do you have for those people? Then you have people who are living with the disease itself, the people living with HIV, but they fear that they may have contracted COVID-19. It's a double-edged sword. Those who believe they contracted HIV and those with HIV who believe they contracted COVID-19. What advice do you have for those two groups?
So the advice is that once you have you've been exposed or you have a sense that you might be infected, the only way of knowing is to get tested.
Nice.
There are now rapid tests where we can get results in a few minutes. There are other tests where results can come up in a day.
Don't wait for diarrhea in a week. Don't wait for headaches.
For the
Don't wait for the silent symptoms.
Don't wait for breathing to become a challenge. Because like I said, in some of the patients, the transition from oxygen saturation dropping from 98% to to 70 takes a very, very short time. And if you delay, you might not be able to catch up and have the doctors or the medical teams repair the damage that has been that has happened. So either way, whether positive or not, the precaution to take is that once you feel you've been exposed or you feel any symptomatology, rush and get tested and get to know. Don't assume that because I have a flu, then this is COVID, or because I didn't get it the other time, I cannot get it.
Yeah.
And we it could be COVID-19.
Yeah, but I think what he's saying is very important.
Yes, doctor.
Some people have what they call them oximeters at home. They keep measuring that I'm 90, I'm what. This is not necessary. If you are walking, the oxygen concentration is normal. By the way, it drops. Even if you have one lung, the oxygen concentration will be normal because one lung can help you.
Yes.
By the time it drops, it is too late. So what I will say is this: don't live in fear. The health system in this country is not very robust, but it's quite elaborate. Every Gombolola has a health unit. They have nurses there. They have thermometers there. Talk to them. You hear people say they say this. Then you ask them who said. Is it the nurse at the health center? Say, no. They. Is it the LC person? They. That they is not good. That is hearsay. It is just theory. Have the number of the person who can advise you on health. And I recommend the number of the district health officer or the nurse at the health unit.
Indeed.
Ask them. If they don't know or they also are ignorant, then you can find somewhere else. We are there. We can help, especially prevent this. So that we don't wait until the system is overwhelmed like what it was overwhelmed. People even doctors were being turned away from what? Mulago, because they were not, what?
Indeed.
No,
they had to go for home-based care system.
We cannot afford that. No oxygen. Some of you have even oxygen cylinders at home. I don't think that is very necessary. It depends on the health system. I want it to be helpful, and I want to use it well to avoid overcrowding it.
Dr. Watiti, we've largely handled the people who fear contracting HIV. What about those who already have HIV and they fear contracting the global pandemic?
Okay. If you have HIV, go for vaccination.
Nice.
If you have access to it. Some people are in my category, even teachers, even some health workers refuse to go for vaccination. Sanitize. Sit at home. If you have fear, the best place is lock the door and sit at home. But of course, hunger will tell you to go out. When you go out, put on a mask. Do the right things and don't live in fear. Look, one time I'm living in fear. These days I sleep like a baby. I don't fear death because I do my best part. I leave the rest to God. And to the Basau, I have Dr. Muganzi. I can call him and ask him, Doctor, what should I do? He guides me. But he sometimes also doesn't know. So what we do, we combine forces. And I pray myself. So don't live in fear. That's what my last word. Don't live in fear. Know the facts. Do what you can. And let's leave the rest to God and to the health workers.
Indeed, do not live in fear. Like Dr. Stephen Watiti is saying, my uncle was diagnosed with HIV when I was 8 years old, but I'm 30 now and he's still looking strong and alive and healthy.
I'll call you for my 70th birthday in 2 years' time.
All right, Uncle, I'll be coming to celebrate that. Of course, if you've been watching, this conversation is largely coming to an end. Yes, we're largely taking a look at those people living with HIV, yes, and how this COVID-19 pandemic has affected them. So in case you need some kind of more guidance, if you need information and counseling, this is how you can reach them. There's a telephone number. Do you have a pen? Yes, you can just simply write 256-200 9444 and 98. That is the first number. The second number is +256 701 4444. That is 45 times 8. All right, 701 4444 8. That is the next number. And there's also a toll-free line, 0800 100 330. 0800 100 330. Yes, we did have Dr. Stephen Watiti. He is the board chairperson for the National Forum of People Living with HIV and AIDS Networks Uganda. He was not alone. We also did have Dr. Alex Muganga Muganzi. He is the head of the Health System Strengthening Department at the Infectious Disease Institute under Makerere University. He's also a board member under the National Forum of People Living with HIV and AIDS Networks Uganda. My name is Romeo Busiku. Do not discriminate on anyone living with HIV. And if you do have the disease itself, please go get vaccinated. There's no problem with that. Get vaccinated and ensure that you keep that face mask on even after getting vaccinated. My name is Romeo Busiku. Have yourselves a blessed day.